We've seen the surge in obesity in this country is nothing short of a public health crisis. And it's threatening our children. It's threatening our families, and more importantly, it's threatening the future of this nation.
And that threat is also here in the Bay Area, with 30.5% of kids in California being classified as obese. The issue of childhood obesity seems to be growing. But not if First Lady Michelle Obama gets her way. Mrs. Obama launched her Let's Move campaign a few months ago because of the negative impacts obesity can have on today's youth.
We've definitely seen over the last several years a rise in diabetes for children, even type 2 diabetes, which normally we would only see in adults later in life. They call it late onset diabetes, but we're seeing it in children.
Jennifer Chankai, a senior health educator with Kaiser Permanente, says diabetes is not the only risk. Children have also been found to have high cholesterol, high triglycerides, fatty livers, heart disease, and decrease in expected lifespan. But obesity does not only have an effect on the physical health of a child, it can also have mental and emotional impacts that may start when children are still infants, but can follow them into adulthood.
Food becomes a representation of mother. And when children haven't been given enough of those very core structures, they crave them. And they'll crave them in the form of food.
Psychologist Marianne Benner says that if a child is having problems with their weight, the entire family needs to get involved.
Nutrition is certainly a key, and exercise is, but the motivation to do those things really is about a family idea. How are we going to live as a family? It's not your problem as the child, or my problem as the adult. It's ours.
And Mrs. Obama is making sure that childhood obesity is becoming our problem. The Let's Move campaign consists of 4 key areas: healthy choices by parents, healthier schools, more physical activity, and getting more families access to healthy food. But one of Mrs. Obama's top goals is to stamp out childhood obesity in one generation, something Chankai is not sure will happen.
Can it change in one generation? Maybe. But I think the way to go about making the change is working with the children under 5 and their parents.
But there are already programs in the Bay Area that have been striving to stop childhood obesity. In the next 4 reports, we'll look at exactly what is being done all around the Bay to stop the scales from tipping. In San Francisco, I'm Ashley Larson, State of Events.